Hello there. Welcome to Smiles by Mary. Our purpose here is to help educate consumers on questions they might have about dentistry, dental procedures, and essentially make them better educated as patients. Today's show is going to be about cosmetic veneers. My name's Dave Swift. I'm the marketing guru, and I'm going to be your host today. And we're today are lucky to have with us Dr. Terrel Myers, a cosmetic dentist with Dallas Laser Dentistry who's been practicing in the Dallas area for over 30 years and is renowned as one of the best cosmetic dentists in Dallas, and in fact has been named Best Cosmetic Dentist in Dallas by D Magazine. Dr. Myers, welcome.
Thank you very much. Appreciate
Glad to have you here. The format for this show is going to be primarily questions and answers, and I have the opportunity to ask nice, simple questions, and Dr. Myers, as the expert in the field, is going to be the one helping us provide answers and hopefully humanize it a little bit and let you understand, as a consumer, what are the questions you need to ask, what are the things you need to understand in terms of improving your smile or improving your oral health. Over the various weeks here, as we do shows, we will also be talking to various specialists and having them as guests, because very often you may be seeing your personal dentist for general dentistry and maybe even some cosmetic dentistry, but oftentimes it's a team effort. And what we want to do is, over the course of the next several weeks, be able to bring in other members of that team so that you can understand what they do and how important it is to the overall end result. Well, Dr. Myers, welcome again. And what I'd like to do is, I think, start with a very simple question. What are veneers?
Actually, veneers are a very thin piece of porcelain, probably not much thicker than a fingernail, and made out of porcelain. And so it's fired in an oven, very strong, very durable, covers up stains, helps change crooked teeth, slightly crooked teeth. So it really improves the smile, brightens the smile.
Okay, so is this something that you would then use for what purposes here?
Well, the ones that I've done in the past, patients were unhappy with their smile. It may be a little crooked. They may have some spaces, just stains in their teeth and spaces, slightly crooked teeth. We can't do real crooked teeth. You have to have orthodontics for that. But slightly crooked teeth, we can do instant orthodontics with veneers.
Okay. Are there different kinds of veneers, or is just all one kind?
Well, there are porcelain veneers. That's the most aesthetic type of veneer. There are resin veneers, which are kind of made at the chair side. They will pick up stain long term, and so the porcelain veneers are the best.
Okay. Veneers are something that people use cosmetically, and sometimes crowns are used. How do they differ?
In the diagnosis, we have to determine if there's enough enamel on the teeth. So veneers are ideal for where the patient has a lot of enamel. In other words, not very many fillings or small fillings, slightly crooked teeth. Where a crown, we have to reduce 3 times the amount of tooth structure to make a crown. Veneers are, like I say, about the thickness of a fingernail, so we can make them very thin. It's very minimal reduction, and so very lifelike. Where a crown, again, is 3 times the amount of reduction, but we go around the whole tooth, where a veneer only covers the facing of the tooth.
Okay, well, can you do veneers on any teeth, or are they best for certain teeth in the mouth? Or?
Well, again, we have to have enough enamel on the teeth, and where I see failures in veneers is where the veneer has gone up onto the root surface, where they've had recession. We can't get a good bond to the root surface, so it's got to be confined to the enamel. So a lot of it's in the diagnosis and the treatment planning.
Okay, tell me about a patient that you've had, and you don't have to give their name or anything, but how it's changed their life having veneers. What did they want to accomplish, and and how were they surprised by how much more it did for them?
I can think of one young lady that came in and she had tetracycline stains on her teeth and just had trouble smiling. And so we did 12 veneers on her, showed whatever shows you do. That makes a natural smile. And when she came back one time, she said, the first thing I did was I went in our house and I took down all the portraits that my parents had taken of me with that purple smile. And I said, we got to have new portraits made, because she said, I love my smile and I don't want to look at that purple anymore. So,
okay. So really veneers have an extra cost, that of taking down all the photographs in your house.
Exactly.
And going to photography again. Okay.
Yeah.
Well, put that into your budget, folks, when you're planning on your veneers.
Yeah.
You'll want to change every picture in your house.
Then I had another patient that we did, for cosmetic purposes, 28 crowns and veneers, kind of a combination, 24 years ago. And he came in last May and said, I want to redo my crowns. And I asked him, why? I said, everything is intact, very good. I said, they look fantastic. He says, no, 24 years ago, you made them the whitest that you make them, but I see whiter teeth now, so I want more white teeth. And I said, they're fine. He said, no, I want white teeth. So we're in the process of doing 20 more that are whiter.
So what's the effect of whiter teeth in terms of your appearance?
More youthful.
Okay.
People smile more. I think in some cases you can go too white, but that's an individual preference, and as long as I make them fit good and work good, I'm good with letting them pick the color.
I'm reminded of that Friends episode where they it was glow in the dark
Yes.
veneers or whatever there, that you don't make those, but
No.
but as white as they want to get other
Right.
than that. Okay. So if somebody's unhappy with their teeth, then, and by their teeth meaning how their smile looks, are veneers the best solution, a solution, and how do you decide which?
You know, that's a good question. It's a solution. Success in dentistry has to do so much with diagnosis and treatment planning. And as I said previously, veneers, we have to have plenty of enamel, and the teeth can't be really overlapped too much. So, and then the crowns we can do more with. We have more freedom, because crowns are cemented on, where veneers are bonded on, and in order for a bond to be strong, it has to be on enamel.
Okay. Okay, so you don't need that for a crown. So
No.
crowns provide more options depending upon a greater
Right.
number of situations.
Right.
So you have to have pretty much a certain set of criteria in order for a veneer not only to be done but to last.
Yes.
Okay.
I've had more than 30 years of experience in this area, and I've had extremely very, very few that have ever broken or come off.
And when they have broken and come off, why has that been?
You know, I can only think of 3 instances, and every patient, it was one, they were in a motorboat and hit a wave about the time they were taking a drink out of a Coke bottle, and bam, and I said it would have broken a natural tooth. So every one of them was a normal accident. It wasn't under normal situations where they were just eating something wrong. Veneers are very strong once they're bonded in.
Okay. Yeah, because you think of something as thin as a fingernail, and you think, gee, that can't be very strong at all.
Right, but it actually is very strong. We get about 95% of the original strength of a tooth back with
Wow.
a veneer.
Okay.
So.
Okay. Well, once you get veneers, if you change your mind like the gentleman you were talking about, and you want your teeth whiter, can you whiten veneers?
No.
Ah,
The
okay.
color you pick at that time is what it stays. And that's one of the advantages of veneers. You do resin bonding or resin veneers, they will discolor. But the veneers will not discolor at all. What you start with is what you end up with. And if the stain does occur, it's a normal polishing and your normal cleaning will take it off. So.
Okay. So your maintenance for a veneer is going to be similar to what you do for your teeth? Do you need to be in more frequently or anything like that?
Not really. Just,
okay.
You know, most staining is a result of diet. So dark liquids, coffee, tea, red wine, those are the things that discolor teeth. It won't discolor permanently the veneer. It'll polish off with a normal cleaning.
Okay. So if somebody wants whiter teeth and they don't have the whitest smile right now, would it look kind of weird to have white on just some of the teeth and not white on the others? How do you guys handle that?
If finances are not controlling all of it, you need to look in a mirror and you need to smile big and look at what shows. When you do a cosmetic case, you want to put veneers or crowns on every tooth that shows. That way it looks normal in the mouth and people love it. What I see sometimes is patients will come in and they'll only have the front 4 or maybe only 6, and they have real dark teeth in the back. What happens there is the contrast, the white looks much whiter and the dark looks much darker, and those just jump out at you, and you look like a horse, unfortunately. But so if they can, you do that. Now, sometimes we will do whiter teeth on the top than on the bottom if they can't afford to do both. It's okay to have a shade or 2 lighter on the top than the bottom. The top teeth show more in smiling. The bottom teeth show more in talking. So depending, I've had some patients that if you're in the industry of meeting clients and your business counts on that, you better do upper and lower. Because if you're doing a lot of talking, I've had trial attorneys that we've done, you do both because they want everything to look normal.
And can they get that same shade of white through whitening process, or do they actually have to replace the teeth with crowns or other
We
veneers?
can do laser whitening. We usually try to do laser whitening in the normal bleaching process prior to veneers or crowning if we're not crowning or veneering all of the teeth, and get them as white as you can, because in that process the natural teeth will still darken with diet and age. But if you start off with a whiter tooth and then make your veneers or crowns match those whitened teeth, then as those darken, all you have to do is re-bleach and you got them right back to your natural color. In the older days, before bleaching, people would re-crown their teeth about every 10 years because their natural teeth got darker and they would get darker crowns. I had one patient come in that she had 24 dark crowns. And she says, I need to redo this, because she says they kept matching my old teeth. And so we ended up doing 28 white crowns on her.
Well, I can see that just going down that dark hole where they get darker and darker and darker and keep paying to get darker. That's crazy. Okay. We've come a long way then, haven't we?
Yes, we have.
One of the questions that I've heard from patients has been they think their front teeth are too long or too short. Are veneers a good solution for that?
Yes. I had one model that came in and she had chipped her 2 front teeth as a young person, and the dentist just shaved them off and made all of them the same length. Well, teeth are supposed to be different lengths. Your 2 front teeth are supposed to be the same length as the eye teeth, and the other teeth between those are supposed to be about 1 millimeter shorter. That makes a very youthful smile. When teeth have worn off even, that ages you dramatically. Ages you usually about 10 years in the smile. So what we do is, anytime you change the length of teeth, it can change your speech patterns. So we do a trial. We do a diagnostic wax-up of what would look really wonderful, and then we try that out in the temporary veneers or temporary crowns. And then we go through, when their lip is not numb, they'll go through speech patterns. We'll say, you know, count from 40 to 50, and the top teeth are supposed to touch your lip on the F sounds, and S sounds that they're not supposed to touch. And so if they're too long, you can't say F sounds. If they're too short, you look old. So yes, we go through a lot of that. And then once we get the temporaries to where the aesthetics is good and the function is good and the phonetics or the way you speak is good, then we duplicate that into the permanent, and then we don't have any problems.
Okay, so there's a lot more that goes into it than putting some goop in your mouth
Right.
and just having some stuff a few weeks
Right.
later put in your, okay. Spaces, is that something you had talked that orthodontics may be needed if it's too extreme, but how big a space can be fixed with veneers or eliminated with veneers?
I've done probably 2 millimeters, which is about a little over 1/8 of an inch. A fairly good space between the two front teeth, but it's very important when you do that to do a diagnostic wax up, because in the case I'm thinking about, we had to do 4 veneers, because if we'd have done only the 2 front ones, they'd look really, really out of proportion.
Okay.
So we can do 4 and reposition, make the 2 laterals or the ones next to the 2 front teeth a little bit bigger, and then we don't have to make the 2 front ones as big, and it looks in proportion. So yes, we do a lot of veneers to close spaces.
Okay, so it sounds to me like that it's not really a mechanical, it's more of an aesthetic with proportions that seem to have certain principles behind them, and that's kind of how you make sure the
yeah.
smile is optimized.
Da Vinci came up with what we call the golden proportion, and there's certain proportions that are more aesthetic, and we use those proportions. And a lot of people, you know, the mother, the father, you get genetics together. He may have 2 big teeth, big teeth and little teeth, and you put them together, and sometimes they don't match up. So when we design a case, we design it by the golden proportion, and that always looks better.
So when we see these Hollywood stars and starlets with their obviously wonderful smiles, are those smiles typically the golden proportion so that
Yes.
they'll look the best?
Right.
Okay. And, okay, well, that's very interesting. You know, one of the things that people wonder about is the cost of veneers and their cost versus doing a crown, or their absolute cost, because you talked about budget constraints or not having budget constraints. I would imagine that fees also vary depending upon the dentist, the cosmetic dentist that you see. And given the fact that you've won some awards for cosmetic dentistry, I'm assuming you're not the cheapest dentist in town. So I guess, how are fees determined in terms of, for those who charge more? Kind of recap for us, what are the important things that a consumer should be trying to find out, whether the prospective cosmetic dentist, what they do in order to make sure that they're going to have the best possible outcome?
Another very good question. That is a question that I get a lot, and fees are determined a lot by what I call care, skill, and judgment.
Okay.
And the lab plays a role in that. Some labs are more qualified to do aesthetic work. Some labs can make 100 crowns a day, and some can make 10 a day. And the ones that do 10 a day have artistry involved in it, and they make them look more real. Those are going to be more costly, time-wise. Again, care, skill, and judgment, and the experience that you have plays a big role. And the success you have, I always give my patients, if they want it, a list of patients that we have done, and let them talk to them. Was it worth it? You know, I've never had a patient, after we've finished treatment, say it cost too much. And I'll have some patients that'll come in, wow, that's a lot more than the previous dentist was quoting me. And I said, well, how long ago did you have that done? Well, 3 years, 4 years. Well, I've got them in that's been in 30 years that are still functioning as good as the day I put them in. So a lot of times you get what you pay for.
Okay, well, that's the basic thing. You get what you pay for, but I think you hit on a really good point there, that what people and prospective patients don't understand is that a veneer doesn't necessarily last a lifetime.
Right.
A dental restoration isn't necessarily something you have to do once. The younger you are, the more times you'll possibly have to replace it. And therefore, the longer that a restoration is in the mouth, the less frequently you have to replace it, and therefore, even if it costs a little more at the upfront, if it costs 50% more at the upfront but lasts 3 times as long, you're much better off in terms of how much you spend over your lifetime. And I think that's what I heard you saying.
Yeah, and you know, one time we were doing a large case. We were doing 28 crowns on this patient, and he asked me how much it was going to be, and I told him. He says, "Man, that's a lot of money." And I says, "Well, what kind of car do you drive?" He says, "A Mercedes." And I says, "How often do you trade it?" Every 2 to 3 years. And I says, "This is going to be a lot less than your Mercedes, and it'll last you a lot longer than your car." And I find that most people, my crowns will last longer than any of their cars they've ever driven. So cost-wise, they're spending a lot more on their car.
I would guess so. What are some of the occupations of folks that have come into you to get veneers where you are actually, in doing this, helping them improve their professional opportunities?
The fair amount. I can think of one young man that really had a lot of dental problems and couldn't smile. He was just an introvert, and he really had some serious problems, and he was so scared. He had had such bad experiences that he just wouldn't go. And when he did come in, we had to extract a couple of hopeless teeth, and we went through a whole process, and actually he didn't have the money to do it. So we do a treatment plan, and we try to work it out to where it can be done in stages if possible. And we did his case over 5 years. And he had to have, gum treatment, and he had to have orthodontics, and he had to have some surgery and some implants. But we did it over a 5-year period. And 1 year after we finished that, he brings in a magazine. He made the front cover of a magazine. And Wow. He was vice president of the company. And he says, "I would have never gotten to this if you hadn't fixed my teeth, because now I'm not ashamed to talk to people, confront people, smile."
So it really changed their complete personality and therefore...
And their financial situation. Yeah.
So I guess one could say that was an investment in their,
it was a good
in their
investment.
professional future. Well, very good.
And with that, I've got 3 generations of patients. Several of my patients. I'm treating the grandparents, the kids, and the grandkids. And I don't think that would happen unless the grandparents were pleased with me in the beginning.
Well, that is true. Now, you mentioned something that was important with this last person, which was underlying oral health. Very often people will want to go and get their smile fixed. And when the dentist sees them, they've got underlying oral health problems that I assume you don't want to put cosmetic work on a bad foundation.
Right, definitely. Another patient we had several years ago was referred to me by her internist, and she was missing most of her back teeth, and she was having a lot of gastrointestinal problems and ulcers and things, and he was trying to treat it, and he says, "You need to go to your dentist and get some back teeth so you can chew your food. You're not masticating or chewing your food properly, and it's causing a lot of gastrointestinal problems." So we did, back then, it was before implants, we did partial and gave her something to chew with, and it's amazing how much her health improved from that standpoint.
So there's definite reasons to get your teeth healthy, everybody,
Right.
not just get them pretty. You need them healthy first. One of the things that that I also have heard asked has been if they're afraid of the dentist or they just don't like to be in the chair for a long time. Do you offer a way, ideally a pill or something, so they can just go to sleep and wake up with pretty teeth?
Yes, we have several different, or a few options. We use nitrous oxide, which is just relaxing. It doesn't put you to sleep, but it puts you in a euphoric state and where somewhat you don't care. But, and that works on probably 90% of my patients. They're very relaxed. We give them headphones so they can play their own music and just chill out. We have night mask that we put on them so the bright lights don't bother them, and when we finish we clear them up in 10 or 15 minutes of pure oxygen. For patients that are very apprehensive, we can do nitrous oxide and kind of a sleeping pill. It's called Halcyon, and that someone has to drive you to the office, someone has to drive you home. It kind of puts you in Never Never Land for about 6 to 8 hours. And that works. They don't even, the great thing about Halcyon is it has the side effect of it is an amnesic effect. So they don't even remember being to the office. And
if you've got a fear of a dentist, that's good.
Yeah,
yes.
And that I use occasionally. And then for the ones that are even more apprehensive, we've got dental anesthesiologists that can come in and do IV sedation while they're doing it. That is more on the expensive side, and that's for a few select people that have the money to do it and want to save their teeth, and but are very apprehensive.
So that is an additional cost to whatever's normally done.
The anesthesiologist will charge for their time while I'm doing the procedure. So
okay, that's great. Well, it's been interesting to hear some of the answers, and hopefully for all of our watchers out there, you've learned a little bit about veneers, about cosmetic dentistry, and about how the importance of having good oral health and having a good foundation before you actually pay the money to have cosmetic work done so that it will last. And you've also heard from Dr. Myers that you can use veneers to do a variety of things to improve your smile, and that improving your smile has a number of benefits, whether it be going over and above in terms of your personality or basically from there. But this is Dave Swift. This has been the Smiles by Mary program. We hope you'll join us again. Thank you for watching us.